Welcome back to the fourth conversation in this series on sickle cell and pregnancy.
What is our topic for this session?
We will discuss the care of women with sickle cell disease during pregnancy.
Yes, managing sickle cell anemia during pregnancy, it requires a very nuanced approach. Now we are dealing with two lives, both potentially vulnerable to the complications of this disease. So there are specific considerations and challenges that we need to address to ensure the best possible outcomes.
And that's precisely what we'll explore next. We'll discuss the specific strategies for managing sickle cell anemia during pregnancy.
Pregnancy kind of adds another layer of complexity to managing sickle cell disease.
Absolutely. It's a high-stakes situation that requires a multidisciplinary approach.
We need a team of specialists, including gynecologists, physicians, hematologists, and even genetic counselors, all working together to ensure the best possible outcomes for both the mother and the baby.
Yeah, it's a true team effort.
Okay, that's great. So once a woman with sickle cell disease becomes pregnant, what are the key considerations for antenatal care?
Okay, so antenatal care for these women needs to be frequent and vigilant. We recommend visits every 2 weeks from 12 to 28 weeks of gestation and then weekly visits after 28 weeks.
Okay,
These women are at an increased risk of complications such as preeclampsia, premature labor and febrile growth restrictions. So close monitoring is really crucial.
yeah.
What specific things are you looking for during these visits?
So we monitor their blood pressure very closely as they are at a higher risk of developing hypertension and preeclampsia. We regularly check their hemoglobin levels to manage the anemia. And of course, managing the sickle cell disease itself also crucial, and medication management is a key part of this.
Sure. Are there specific medications they need to take?
Yes, so folic acid supplementation is vital for all pregnant women, but even more so for those with sickle cell disease. And we usually start them on low-dose aspirin 75 mg daily at 12 weeks of gestation.
What's the rationale behind the aspirin?
So it helps reduce the risk of preeclampsia, a serious complication that can occur during pregnancy.
Okay. Are there other medications that they should avoid?
Yes, absolutely. So hydroxyurea, which is a medication often used to manage sickle cell disease, needs to be stopped at least 3 months before conception. And ACE inhibitors and ARBs, which are commonly used for hypertension, are also contraindicated during pregnancy.
Okay. So careful medication review is essential. Okay, let's move on to another critical aspect of management, and that is blood transfusions. So what is the role of blood transfusions during pregnancy in women with sickle cell anemia?
Okay, routine prophylactic transfusions, meaning receiving transfusions regularly during pregnancy as a preventative measure, are no longer recommended.
Why is that?
Well, we have realized that they don't necessarily improve outcomes and they come with their own set of risks such as early immunization.
So when are transfusions actually considered necessary?
So transfusions are now given based on clinical need. For example, if a woman's hemoglobin levels drop significantly below her baseline, or if she develops certain complications like acute chest syndrome, a transfusion might be warranted.
So it's more individualized approach now.
Exactly.
Let's discuss another challenging aspect of sickle cell anemia: pain management. How do you approach pain management during pregnancy while ensuring the safety of the fetus?
For mild pain, we recommend acetaminophen, which is considered safe during pregnancy.
And what about more severe pain?
Right. For moderate to severe pain, we can use non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen during the second trimester, but we generally avoid them in the first and third trimesters.
And why is that?
NSAIDs can adversely affect the fetus, especially in the first trimester, and may interfere with labor and delivery in the third trimester.
What are the alternatives for severe pain in the first and third trimesters?
So in those cases, we can use opioids such as morphine or dimorphine. And these medications are very effective for managing severe pain, and they're generally safe when used, under careful medical supervision.
Sure, are there any pain medications that should be strictly avoided during pregnancy?
Yes, pethidine is an opioid contraindicated during pregnancy as it can cross the placenta and cause respiratory depression in the newborn.
It's about choosing the right medication at the right time and carefully weighing the benefits and risks.
Exactly. We also encourage non pharmacological approaches such as relaxation techniques, warm compresses, and gentle massage.
Yeah, those can be very helpful in conjunction with medications.
So let's conclude this session here.
In the fifth part of this series, we will discuss about the care of women with sickle cell disease during intrapartum and postpartum period.
So goodbye for now and stay tuned.